Hey, Dr. Berg here. In this video, we're going to talk about the risks of calcium supplements. That's right. Primarily the supplement calcium carbonate. Now, calcium carbonate is a form of calcium that is basically limestone. It's rocks. And that's in probably all of the most popular traditional multivitamins and calcium supplements that you get on the market from CVS, and that's the most common recommended calcium by doctors. Okay, it's pretty much it's rock, stone. You'd be better off chewing on the cement outside because it's not meant for humans. All right. There's been some new research that even says that when you take calcium carbonate and vitamin D, it does nothing for bones. I provided a link. In fact, it will increase the risk of cardiovascular accidents or incidents. Now, why is that? Because when you have plaquing, that plaquing is not just cholesterol plaquing, it's calcium plaquing. But you don't really hear any anti-calcium movement. It's more like anti-cholesterol, which is very interesting because if you have coronary artery calcification, which is too much plaquing in those arteries, your risk factors for heart attacks go up by 1,600%. And I think I know why. Number one, it's the source of calcium that you're taking, which is the wrong source. And then the other thing is that every decade a person ages, their pH in their stomach gets weaker and weaker and weaker. Now, in a normal stomach, and you can check on this. I created a gallbladder video you should watch if you want more information on this. But the stomach should be between 1 and 3. That's, if you ever studied chemistry, pH neutral is 7, and then it goes down. That's more acid. Okay, so if it's a 1, it's so acidic it can dissolve a razor blade. So it should be between 1 and 3, and that's very acid. That's why you need the stomach very acid. But every decade you age, you lose some of that acid. When you get into your 50s, 60s, 70s, and 80s, and 90s, oh my gosh, there's hardly any acid in your stomach. And that's why you see a lot of people when they get older to start having indigestion, gas, heartburn. That is not too much acid. That's not enough acid. And some of the waste acid is coming up through the lower intestinal tract, splashing up here. And that's why they're taking things like Prilosec and Tums, which is the exact opposite thing you want to do, because now we're going to take out that last bit of acid they had, and they're not going to digest, and they're going to just feel bloated, and they have to keep taking it. So it's not very corrective. But anyway, when you lose your stomach acids, your blood pH starts becoming a bit more alkaline too. Okay, so when it comes to alkaline, now you can't absorb calcium. Calcium is very alkaline. In order to absorb it, you need a very acidic stomach and the correct pH in your blood. You don't want it too alkaline. It's called alkalosis. Calcium does not absorb. Where does it go if it's not absorbing? In the bone of the muscle. It's going on top of the bone as arthritis, bursitis, tendinitis. On the joints is calcium deposits, heel spurs, cataracts on the eyes. On the nerve is twitching in the left eye. Get cramps in the lower calves. You'll get stones in the kidney, stones in the gallbladder, calcification of your arteries. Yeah, that's all from pH problems. So we have also what could cause alkaline pH would be high levels of stress or that high cortisol, that adrenal hormone again. That can also make your pH so alkaline that your calcium won't be really reabsorbed properly. It's kind of like if you ever go outside and your faucet outside, you'll see that little calcium ring around the faucet. That's because the pH is too alkaline in the water, and that calcium comes out of solution and deposits around the little ring. And it's just a pH thing. So again, on your bodies, people are becoming calcified, and especially because they're taking so much calcium carbonate. All right. Another cause would be excess vitamin D. And this is interesting because how many people are taking vitamin D now? Now, I did create a video on vitamin D, and you should watch it if you have not. I think it's under the new, it's in one of the blog videos. You'll be able to find it on the page. But here's the interesting thing about vitamin D. Vitamin D takes the calcium from your stomach and puts it into the blood. It concentrates it into the blood, all right? And then from the blood, vitamin F, which is the helper vitamin, takes it into the tissues the bones, things like that. So if you're not having enough vitamin F, which very few people even know what that vitamin is, and all this vitamin D and calcium carbonate, and you're older, oh my gosh, you're just like calcifying, you're becoming a rock. You're going to get stiff. You're going to have all sorts of stones, kidney stones. What you need to do is take vitamin F. Vitamin F is in the flax oil, cod liver oil. But flax oil is a really good vitamin F source. Okay, so that would help you balance out vitamin F. I'm sorry, vitamin D. So they both work together. Another cause of excess vitamin D would be stress, because that cortisol, again, depletes and blocks the absorption of vitamin D. These are all just potential causes of problems with calcification on your arteries that I want you to look at, rather than just having a one viewpoint, fixed idea on it. So we got low vitamin F, stress, and low bile. Okay, now we're back to the gallbladder again. Bile is the detergent that breaks down the grease. It's made by the liver. It comes through the gallbladder. It helps you absorb fats, specifically fat-soluble vitamins, and that would be vitamin D. Vitamin D is the fat-soluble. So if we have a liver problem or a gallbladder problem or no gallbladder at all, you don't really absorb vitamin D very well, and so you're going to be taking all this vitamin D, but it's not really going in your body. It's being stored in the liver and the kidney, and that's why too much vitamin D causes more stones and kidney stones, things like that. And just as a side note, vitamin A helps protect against kidney stones as well, and that would be in the kale. Okay, remember that. Now, there's two types of minerals. You have rock-based minerals from the soil, and then you have plant-based minerals. The way nature is intended is the plant is designed to break down the rocks in the soil and through enzymes and pull them into the plant and convert them into a plant-based mineral that then we can actually absorb in our bodies. That's how it's designed. But people don't pay attention to that. They just eat the rocks, like calcium carbonate. I'm going to recommend you get your calcium from not necessarily milk, because it's pasteurized unless you have raw milk, because when you heat the milk, you actually destroy the absorption of the calcium. But more in a fermented milk source would be something like cheese, yogurt, kefir, or any of the greens like spinach has a lot of calcium, or almonds or other nuts, or sea kelp. Okay, so I just wanted to, again, bring your awareness up on this darn calcium, because if you think you're getting your calcium from taking that calcium carbonate, which the bottle is like a paperweight, it's so heavy, it's a joke. And now they're finding that calcium carbonate actually causes, heart attacks. It's just insane. So again, we boil down to the problem where if you're going to someone they're not trained properly in nutrition, you may get the wrong advice.